Hello. Today's lecture is going to be over chapter 14, Pharmacology. Chapter 14, Pharmacology. So administering medicine is a serious business. And as an EMT, we're going to help patients self-administer medications because some of their medications can alleviate pain and improve their well-being. We're also going to ask patients about their medication use. And if we use the medication inappropriately, it very well may cause harm and even death to our patient. And that's probably, I'm kind of a firm believer that's not a good thing to do. But if you're okay with causing death to your patient, you might be thinking, I'm thinking you might be trying to get into the wrong business. We're also going to report information to the hospital personnel about the medication that we've issued our patient. So the term pharmacology is the science of drugs, including their ingredients, their preparation, their uses, and actions on the body. And there are going to be certain medications or drugs that you will be approved to administer and assist the patient with their own self-administration. So what do we need to know about the medications that you, the EMT, administer? Oh, just some important stuff like how not to kill your patient. That's pretty important little piece of advice there. So how does the EMT administer the medication? Obviously very carefully. But before you administer any medication in the field, you should confirm the order and document the fact that you have administered the medication. You want to ensure that the prescribed medication is actually the patient's and not somebody else's. In the state of Texas, it is illegal to take other person's prescribed medication. And we see this with husbands and wives and friends occasionally, especially that have cardiac problems that take nitroglycerin. One of them might be out and they'll ask the other one that takes it also if they could have a couple of their tablets, which is it's against the law, but it happens. Because they're having chest pain, and they're out of nitroglycerin, they want to stop the chest pain. But each dose of medication is based to the person that it's prescribed to, based on symptoms as well as weight. So you need to make sure that the medicine that you are assisting with is actually the patient's and not somebody else's. And you're always going to comply with your EMS service protocols. Talk about some routes of medication in abbreviations. PO, meaning per orally, also known as per the mouth. SL, sublingual. Now, here's where it gets a little dicey right here. We have per orally and sublingual. Sublingual is under the tongue. PO, per orally, means on top of the tongue and down through the digestive tract. Where sublingual, under the tongue, it actually disperses into the circulatory system. So don't mix the two up. Yes, both of them pass the lips. One is orally, one is sublingual. We also have inhaled medicines, such as oxygen. We have intranasal, such as Narcan, used for opiate overdoses. We have intravenous, and we don't so much use that as an EMT, unless you happen to be riding with a paramedic. But the intravenous is where a catheter is inserted into the vein, and then the medicine is administered through the catheter direct into the vein, intravenous. IM, intramuscular. We use intramuscular when we administer epinephrine, the EpiPen. And then we have the subcutaneous. Subcutaneous is a not so deep that it's intermuscular. It's above the muscular part of the body, but so it just goes barely underneath the skin, subcutaneously. So now we need to talk about some terminology. The term indications or indication for giving a drug. These are specific signs, symptoms, or circumstances that make it appropriate to administer a drug. The drug's indication for a specific sign, symptom. So you have to know those signs and symptoms and circumstances to be able to administer the drug. Example of that would be a 45-year-old male having chest pain. The indication is for nitroglycerin in chest pain of cardiac origin. So we have indications, but on the other hand, we have contraindications. Contraindication is when not to give a drug. A drug's contraindications are specific signs, symptoms, or circumstances where it would be inappropriate or harmful to administer a drug. Example would be a 45-year-old male having chest pain 2 hours after using a sildenafil type product known as Viagra. We'll talk more about that as we go through this terminology. We need to know the dose. How much should be administered to a patient? EMT drugs are in milligrams. The mechanism of action or actions are the desired effect of or the expected effect on the patient after the drug is administered. We expect some things to happen and they don't happen. Sometimes we get something that's not supposed to happen. The route, in what way did you get the medication into the patient's system? Was it orally, PO, by mouth? Or was it intermuscular, IM, by deep injection? Side effects. Any action of the drug other than the desired actions. Another way of looking at side effects are what are predictable problems that will occur that may be an annoyance but does not contraindicate the usage of the drug. So the drug side effect is any action of the drug other than the desired action. Example, we have our 45-year-old male having chest pain. He took his own nitroglycerin, and now he has a massive headache. That is an expected side effect of nitroglycerin, because the nitroglycerin is a vasodilator, and it vasodilates all of the vessels in the body, including in the brain. So that's where this massive headache comes into play. It's very short-lived. It doesn't go for hours and hours. It's for probably 2 to 5 minutes. But they'll tell you, and you ask them, do you have a headache from the medication? They're going to say yes or no. You expect them to say yes. They go, oh man, that's a horrible headache. But it's very short-lived. And speaking of the nitroglycerin side effect of the headache, that's another way that we can tell if the drug is effective or if it's out of date. Because if they don't get a headache from the medication, then that's indicative of the medication not being in date and not being used to its full potential. Next, we have medication names. Every drug is listed in the U.S. Pharmacopedia, and that's a government publication. You can find it on the internet, Google it, and it's, I don't know, probably 4,000 plus pages. Be good bathroom reading material if you had nothing else better to do. And the U.S. Pharmacopedia lists the drugs by their generic name, by their chemical name, by their trade name, also by their official name. Generic name is a general name that's not any brand of any manufacturer. Chemical name, hence it's a chemical formula. And then the trade name, also known as the brand name, is the name the manufacturers it. Bayer. So examples of medication names: generic name epinephrine, the chemical name B3,4-dioxyethylene ethanol, however you say it. It's a whole lot easier to say epinephrine or the trade name EpiPen instead of trying to pronounce the chemical name every time you need a drug. So medication administration. Circumstances to administer medicine is peer-assisted medication. Peer-assisted meaning you're working with a paramedic or you're doing your internship, and they may ask you to hand them a certain medication. That would be peer-assisted medication. Patient-assisted medication, that's where you are assisting the patient with their own personal medication, assisting them to administer or to get the bottle and hand them the pill. That would be patient-assisted medication. EMT-assisted medication, that's where you're actually giving the medication. Could be in the form of an EpiPen. It could be nitroglycerin. It could be oral glucose. How about oxygen? EMT administered medications. And all this is determined by state and local protocols and your medical control. So medications that are carried on the EMT BLS ambulance can include activated charcoal, aspirin, oral glucose, oxygen, epi-auto injector, and some ambulances, EMT ambulances, are now carrying Narcan for opiate overdoses. Here in the Metroplex, we don't really have any EMT ambulances, but you would find all these same identical drugs on the paramedic ambulance. Now, activated charcoal is not being used as much as it used to be, but it's still showing in the books and National Registry test on it, so you need to know what's carried on the ambulance: activated charcoal, aspirin, epi-auto injector, oral glucose, and oxygen. Some medications that are prescribed to the patient that you as an EMT can assist with. These are drugs that, medications that will be found in the patient's possession that are prescribed by the physician. And they can include metered dose inhalers or nebulizer treatments, nitroglycerin, either in a spray bottle or in tablet, epi-auto injectors, and aspirin. The key about aspirin, we're not talking about Tylenol or anything like that, just straight aspirin. With aspirin, most of the time, if the aspirin's on the ambulance, it's baby aspirin, which is 81 milligrams. If it's an adult aspirin, if you're assisting the patient with, and they maybe have it at their house, it's 325 milligrams. But they're both legal dosages for the patient. Now, the thing with aspirin, in the area under the Biotel protocol, which y'all will be working under, we do not administer aspirin for headaches, fever. Somebody turned an ankle and it hurts. We don't use it for pain relief. We only use it for chest pain of cardiac origin. So with dosage of medications, we have what is called the 5 rights of medication administration. And I know you're saying right now, well, he's got 6 rights of medication administration. 5 are in the book. The last one with the asterisk by it is something that you cannot forget to do: documentation. So the 5 rights of medication administration. Number 1, do I have the right patient? Is it the patient's medication? Number 2, do I have the right medication? Read the medication name out loud, read the expiration date out loud, then reread the medication name out loud again. Then you hand it to your partner, and they're going to read the medication name out loud, the expiration date out loud, and reread the medication. Then you dose the patient. In the back of the ambulance, there might be 4 or 5 of you in there, And that medication may go through 3 or 4 hands. Every person that touches it and make sure that it's the right medication out loud. Is it the right medication? Expiration date, and then reread it again. You need to know the right dose. Is this the right dose? You need to know your dosages to ensure you're giving the proper amounts. Am I giving the right route of it? Am I giving the drug via the right route of administration? You need to know your routes of administration. Nitroglycerin is sublingual, whether it's a tablet, whether it's a spray, it's sublingual. You don't want to squirt a nitroglycerin up in their nose. You don't want to put it on top of their tongue, underneath, sublingual. Know your routes of administration. Is it the right time? Giving medications on time versus giving too soon becomes very important, because like with nitroglycerin, we can dose our patient with nitroglycerin up to 3 times, and we dose them every 3 to 5 minutes, no sooner than 3 minutes, no later than 5 minutes after the first dose, after the second dose. We can give up to 3 doses, but we want to make sure that we're giving it at the right time in that window of 3 to 5 minutes. And then right documentation. Am I performing the right documentation? Completely document all drugs you have administered, because it becomes part of the patient's permanent medical record. So there's 5 rights plus the asterisk of, do I have the right documentation? Because this is what the lawyers are going to do to the EMTs that don't check for the 5 rights of routes of drug administration. 5 rights. And then the 6th being, make sure you do your right documentation. Don't give the lawyers anything to work with. So now we're going to talk about some forms of medication administration. Medications come in multiple forms, all of which you should become familiar with, even though some forms are used by EMS and others are not. The form of medication usually dictates the route of administration, and the manufacturer is the one that chooses the form to ensure that the proper route of administration, timing of its release into the bloodstream, and the effects on the target organs or body systems. Some basic forms of medications that we will go over: tablets and capsules, solutions, suspensions, metered dose inhalers, topical medications, transcutaneous medications, gels, gases for inhalation. These are just some of the medication forms. Compressed powders or tablets. Nitroglycerin tablets. These tablets at one time were becoming obsolete in the EMS field for a spray that gives out the same dosage. But now with the cost of medications, the same identical dose, if it's in a spray bottle versus the tablets in this little brown bottle, and the reason why they are carried in a brown dark bottle is because nitroglycerin tablets lose their potency when they're exposed to sunshine. So they're to be kept in a dark container. The nitroglycerin that's in a bottle like this, or nitroglycerin spray, nitroglycerin spray is upwards of $300 for a bottle of like 90 doses of nitroglycerin via spray. This nitroglycerin tablet runs around $50 to $75 for the same 90 pills. Same dose, one's a spray, one's a tablet. One's very cheap, the other's very expensive. Another example of a compressed powder or tablet would be the aspirin. Liquids for injection, such as in the EpiPen. We have gels, glucose. This gel that we use for the diabetic is about the consistency of toothpaste. Basically what this is sugar in a tube, but it's like toothpaste. Suspensions. Suspensions are powders that are in water that must be shaken well to make a thick slurry. We use these suspensions for overdoses, for certain overdoses. Once again, this is one of those medicines that you don't see as much in the field as we used to. Gases. Gases that we use are primarily oxygen, which you're going to need an oxygen delivery device such as a non-rebreather mask or a nasal cannula to administer. Sublingual spray. Once again, this is the nitroglycerin spray, upwards of $300 versus the tablets around $75 to $100. Same dosage, big price difference. But both nitroglycerin spray, nitroglycerin tablets are sublingual. We have liquid albuterol as a liquid that we use that's placed in the nebulizer chamber. Then oxygen's attached and the medication is aerosolized for inhalation. Here we have a meter dose inhaler. It's a fine powder for inhalation. It's aerosolized under pressure. You might hear somebody say, I need my inhaler, I'm having trouble breathing. This is just another form of getting albuterol into the patient's lungs. Inhalation medications, MDI nebulizers. Remember, the nebulizer uses a liquid turned into a mist or spray. The meter dose inhaler uses a fine powder. The medication is then breathed in and delivered to the alveoli. It's a direct route straight down the trachea into the bronchi, bronchioles, out into the alveoli. It's very quick acting because it has direct, easy access. And they're both portable. So what medications are you, the EMT, responsible for knowing? Just 7 of them. No big deal. But the bright side of this is that when you go to paramedic school, you're already going to know 7 different medications, what they're used for, how to administer them. You know, you're going to be ahead of the ball game because medicine in medical school, in paramedic school, medic school, you will have already learned 7 of the 100 drugs that you have to know. So now you only got to learn 93. So the drugs that you need to know about: activated charcoal. It's administered to patients who are conscious and have an intact gag reflex, not used in those patients who don't have an intact gag reflex. It's used to treat poisonings or overdoses. It absorbs some poisons and it helps prevent absorption by the body. It's used when the patient's overdosed or been poisoned by swallowing substance that will be absorbed by the digestive tract. It comes prepared as a slurry, or it can be in a powder that's pre-mixed in water. What it does is it binds to the poison and prevents absorption. Oral glucose, also known as instaglucose, is a simple sugar that is administered orally as a treatment for a conscious patient with an intact gag reflex, but who has an altered mental status. Diabetics who have difficulty regulating their blood sugar will often carry one of these. They know they got to get some sugar into themselves. They can't get a sandwich or something, so they'll have this tube of oral glucose. Diabetic might, and what it'll do is it'll boost their sugar up high. Problem is, it'll come down quickly. So by that time, they should be able to get something to eat to offset the difference. It's a tube of gel that comes in different flavors: cherry, lemon, blueberry, plain. And because it's a simple sugar, it's easily and rapidly absorbed by the GI tract and into the bloodstream. Oxygen. Oxygen is a gas that's 21% of the concentration of air. It's a drug used to treat hypoxia. And it can be used on any patient, medical or trauma, that the condition may cause hypoxia. It can be used to treat the chronic hypoxia, so it can be found in a patient's home. Conditions that may require oxygen administration include respiratory distress, respiratory arrest, cardiac arrest, heart attacks, stroke, shock, medical or trauma related, blood or fluid loss, broken bones, blood loss, and healing process improves with oxygen, head injuries. So in other words, we basically can give oxygen to just about anybody. Metered dose inhalers, also known as MDIs, also known as prescribed inhalers, deliver the same amount of medication each and every time it's used, such as It delivers an metered dose, a set amount. Advair, Singulair, Accolade are used as daily meds to control chronic breathing difficulties, but are not included in these metered dose inhaler. In other words, we don't carry these on the ambulance other than just a metered dose inhaler. Inhalers we're talking about contain medication to treat an acute onset of respiratory distress that affects chronic conditions such as asthma, emphysema, chronic bronchitis. And our most commonly encountered meds include albuterol, Proventil, Ventolin, Atrovent, Alupent, and Bronchosol. These are all the different commonly encountered meds that we would use in the ambulance. The meds are considered bronchodilators. And what this does is they're designed to dilate the bronchial airways that are constricted down because they have a direct route to the bronchioles, so it's very quick acting. Side effects of these medications can include increased heart rate, also known as tachycardia, increased patient jitteriness because it's speeding up the heart, so they have this feeling like their heart's going to jump out of their chest. Nitroglycerin, also known as Nitrostat, most commonly found as a nitrolingual pump spray. If you're using the pump spray, be careful, don't inhale it, don't get it on your skin because it's a vasodilator. And if you get it on your skin or you inhale it, because we use this as sublingual, it's going to vasodilate you. So don't get it on yourself. One spray equals 0.4 milligrams, same dose as the little white tablet, 0.4 milligrams. Patients with chronic heart conditions can experience episodes of chest pain, and the patient that has recurrent chest pains usually have been told by their physicians to take a dose every 5 minutes up to 3 times before calling 911. This is a very, very common prescribed drug to patients. So first, we're going to evaluate the patient's condition and obtain a set of vital signs. If the systolic blood pressure is less than 90, we will not administer nitroglycerin. If the patient's taken any type of sildenafil type product within the last 24 to 72 hours, we're not going to administer nitroglycerin because the sildenafil type products are vasodilators also. We don't want to crater their blood pressure. Side effects of nitroglycerin administration: headaches, hypotension, decreased chest pain. If found profoundly hypotensive, our patient, we need to place them in a Trendelenburg type position, get their feet up a little bit, and contact medical control. Epinephrine, our epi-auto injector. We use these for acute allergic reactions that can occur in our patients that are highly allergic to certain substances, such as shellfish, penicillin, bee stings. An allergic reaction after an exposure to an allergen can cause life-threatening bronchoconstriction and vasodilation. Excuse me. So this epinephrine will help constrict the blood vessels. It dilates the bronchioles, which then in turn allows the patient to breathe more freely and helps in reducing the shock symptoms. The EpiPen is an auto-injector, which is a syringe containing epinephrine and a spring-loaded needle. The good thing nowadays with these EpiPens, the older EpiPens like you see here in the pictures, the needle would come out, but it would not retract in, so you were very susceptible to having a puncture from a sharp of somebody's needle that had just injected into their skin, so you would have an exposure. The EpiPen now, it injects the needle out, the medicine into the patient, then the needle retracts back up into the EpiPen. All EpiPens are only good for one dose. That's it. You don't get 2, 3, 4 doses out of it. It's one dose. It's all or nothing. You can't stop it halfway through. The Epi-Auto injector is held against the thigh. Spring-loaded needle fires and injects a preset amount of medication into the patient. Side effects of the EpiPen, Epi-Auto injector: increased heart rate because it speeds up the heart, increased blood pressure, and usually returns the blood pressure to normal. Aspirin. It's administered to our patients experiencing chest pain. It's not for headaches, not for fever, not for somebody wanting some pain relief, strictly for chest pain. During a myocardial infarction, also known as a heart attack, a fat globule or chunk of calcified plaque breaks off and travels to one of the coronary arteries, where it blocks up the flow. The body then in turn responds to this insult by sending platelets to attack the source of the problem. As they arrive, the platelets begin to aggregate and clump together. They're trying to beat up on this insult from this plaque breaking off. And these platelets clump up against each other, which actually worsens the problem. So aspirin inhibits the platelets' aggression by placing almost like a Teflon covering over the platelets so that they don't clump together. That's why we get that aspirin on so quickly. The dose is 4 81 milligram baby aspirins or 1 325 chewable aspirin. Now, with that said, years and years ago, we gave 325 milligrams of aspirin to our patient complaining of chest pain of cardiac origin, and there was one slight problem. We'd ask them if they're allergic to aspirin, and they'd say no, and they say, well, and you're having chest pain. Well, we need to have you give you an aspirin, and you need to chew the aspirin up. Well, I don't know if any of y'all have ever tried to chew an adult aspirin. If you have, it's not a good experience. And if any of y'all use BC powder, basically that's just smashed up aspirin. Being it's smashed up, it gets to where it needs to go quicker, but aspirin has a really bad taste if you chew it. So the patients used to ask, well, can I have some water? No, we can't give you any water, you got to chew it up. And we'd have, Patients would do it, wouldn't do it, refused to do it. And finally, the doctors that make all the rules and regulations, because we were arguing the point that, well, why can't we give them 324 milligrams versus 325 milligrams? Because that 1 milligram is not making the difference of the chest pain going away or staying. And we can give them chewable aspirin that have some flavor to them. And the docs finally agreed. And to this day, we now use baby aspirin, 4 baby aspirin at 81 milligrams, come in orange, come in grape, come in cherry, all different flavors. And we give them 4 81 milligram chewable aspirin by mouth, and they don't have any problem taking them. So this is the end of chapter 14, pharmacology.